in our schools. That's what we are focusing on today. Since we've started recording cases as expected, we'll focus on it. We began recording COVID-19 cases as expected, and it's been almost 4 weeks since schools in Ghana reopened amidst concerns about the timing since the country has started experiencing the second wave of the virus. Not just that, the UK strain, which is more infectious than the previous one, is right here with us. Should we take a second look at the decision to reopen schools, especially when we are now struggling to get vaccinated? What exactly is the plan? Is there even a plan is the question. How many schools have recorded cases and how is it being managed? Tonight, we seek ways to curb the spread in our schools and protect our future leaders. But first, we'll take a look at our COVID-19 rankings as a country, as I call it. That's our situation. In terms of our active cases, we have 4,665 cases. That's where we are. In terms of our cases, it looks like we've gone up. Since that, we're about 6,000 cases now, and confirmed cases as a country, 65,427. That's where we are. The number of deaths we've recorded, 416. I beg your pardon, it looks like we'd have the wrong figures on our screen, but we have the 416 deaths recorded so far. We'll get you that accurate figure. So the last time we checked, we have over 6,000 active cases as a country and over 400 deaths recorded as a country. That's where we stand. But tonight, I'll introduce to you my guests. Shortly joining me via Zoom is the Executive Director, Inspector General of Schools, National Schools Inspectorate Authority, NASIA, Dr. Hilda Ampedu. We also have the Chairman, Vice Chancellor's Ghana, VCG, also the Vice Chancellor of the University of Health and Allied Sciences, Professor John GYAPONG. We also have the President, Ghana National Association of Teachers, GNAT, PHILIPPA LARSEN, and also Alhaji Yakub A.B. Abubakar, President, Conference of Heads of Assisted Schools, CHAS. You are my guests tonight via Zoom. Join me with your thoughts and comments. It's via WhatsApp. You can leave them on our WhatsApp platforms. Also on Facebook, you can leave your comments there. Remember, we're live on the Joy News channel, also on Joy 99.7 FM together with affiliates across the country. In Kumasi, we are live on Love 99.5 FM. Also on Joy Prime. On YouTube, we are live. Also on Facebook. DSTV channel is 421. GoTV is 144. I am MFA Paul. Welcome. And don't forget to send in your comments. Thanks for staying with us here on the Joy News channel. We'll get straight into action. I have a number of your questions, loads and loads of them. So let me bring in our guests via Zoom. Tonight, I've been telling you about Professor John GYAPONG. We also have the Executive Director, Inspector General of Schools, National Schools Inspectorate Authority, NASIA, Dr. Hilda Ampedu, Chairman, Vice Chancellor's Ghana, VCG, Vice Chancellor UHAS, Professor John GYAPONG. We also have President, Ghana National Association of Teachers, Madam PHILIPPA LARSEN, and of course, Alhaji Yakub A.B. Abubakar, President, Conference of Heads of Assisted Schools, CHAS. Thank you very much, gentlemen and lady, for your time tonight here on The Probe. You're welcome.
Thank you.
Thank you. Thank you.
Well, it's not a good night for Professor John GYAPONG. Your team lost. I hope you're coping very well. I hope you're doing well.
Alone.
Yeah. Okay. Well, we'll see about that. But I would first want to start with you, Madam PHILIPPA LARSEN. So there's concern about the number of cases recorded amidst students, but we can't forget about our teachers as well. First off, what's the situation amongst your members across the country?
Well, thank you very much, MFA. Let me say good evening to your audience. For now, we have no data as to the number of teachers who have been infected. We have some issues about the fact that some students or learners have been infected. And even that one, we don't have the full data. But in terms of the protection at the various schools, everything is set. And for now, so far, so good.
But what happens, do we know, is there any protocol in place, for instance, if teachers get infected?
Yes, the decisions that are taken are, I believe you are aware that all schools have been mapped to various health facilities. In the senior high schools, they have infirmaries already, and they have health staff affiliated or connected to the schools. And even those who do not have infirmaries, they have been mapped to the various health facilities. And so anytime there is an emergency, the best thing is for the staff of the school to report the issue.
Okay. So it appears we have a technical hitch to Madam PHILIPPA Larsen's connection. But let me bring in Dr. Hagar Ampedu. Last week...
And quickly...
Okay. We'll try and sort that out to Madam PHILIPPA Larsen. But let's bring in Dr. Ampedu. Dr. Ampedu, I know that last week has been a very busy one for you because a number of cases were recorded, especially in the eastern region, Akosombo, we are told. You've been checking. What exactly is the brief you have?
Thank you, MFA, and good evening to your audience. So you're right. We got a report on a school in Akosombo, and my inspectors were there to ascertain the situation on the ground. And it was confirmed that they had positive cases there. So far, they had recorded 79. But it's encouraging to say that the Ghana Health Service, the Regional Health Directorate, and the Municipal Health Directorate in Akosombo are on top of it. They are working very well with the schools, COVID management team, and all those who have tested positive are being taken care of by the Ghana Health Service.
79 cases, all students?
Students and staff.
Okay, well, but...
5 staff, the rest are students. So we have 74 students and 5 staff.
Okay, but what exactly, how is it being managed from what you gather?
So COVID-19 is a national problem. So there's a national team on the management of COVID. So the national team has taken over the case, and it's led by the Ghana Health Service, as we are very much aware of. So the Regional Health Directorate is in charge in the region, together with the Municipal Health Directorate. They are treating the positive cases. And I'm sure you've also heard that the school took it upon itself to test almost all the school's population. So far, 500 or so people have been tested at UHAS. So of the 500 tested, 79 have tested positive. And Ghana Health Service is working very well with the school to manage the cases that are positive.
Now that you mentioned UHAS, it's a good time to bring in Professor John GYAPONG. So it appears that you've been testing all the cases that we are recording, especially in Akosombo. What exactly is the situation, Professor GYAPONG? Have we recorded cases in your outfit as well? But tell us first about the tests that you've done so far, and I'm sure the positive cases, especially in the eastern region.
Thank you very much, MFA, for having us. Yes, we've been testing on behalf of the Eastern region for the Akosombo enclave in particular. And I don't have the exact figures, but all I can say is that, yes, quite a
Apologies, Professor GYAPONG, we have a terrible connection. Technology is not on my side tonight, but I pray that before we end, everything will be fine. But whilst we work on the connection to Professor John GYAPONG, let me bring in Alhaji Yakub. Alhaji, we've been told that most of your schools or most of your members, in trying to manage the cases, you've been telling parents not to talk about it, to keep mute, threatening children, not to also tell people outside the school about the cases that are being recorded. What exactly is the plan in place? How exactly are you dealing with the situation? Why are you keeping it under wraps?
Thank you very much, Emifa, and I greet your viewers and then listeners. Indeed, we are all aware that COVID is a national and international issue now with us. And every outfit is trying to see how best we can manage the situation. At our school level, that is the senior high level, most of our students are agile, very strong and moving about their activities. You wouldn't even know anybody has it. Even the very few that for some reason have been tested and then confirmed that they have been affected, you see them, you don't see anything indicating on them. So we go through the protocol as has been laid down, the guidelines given us to ensure that any suspected cases is first of all taken up at the school level at our sick bay or clinic. Then referrals are made to health facilities that we are attached to. And from there, they handle the case and move on with it. To some extent, it isn't that we are, as it were, suppressing information, but we're also trying to work in such a way that we do not create panic in the system, where parents will just hear this and they will start putting up reactions that are uncontrollable. So we will wish that, first of all, the parents contact the school, who will give them the necessary information. And from the school level, if the case has been referred to the next level, then we'll refer them there for further information if they indeed need. But there has not been an occasion where we have told parents that you will not be told what has happened to your ward and that just rest assured he's been taken care of. No. Anytime referral is made to outside, we make sure that the next point is to call the parents and inform them that this is the situation. And from the school level, the case has been referred to the health facility attached to the school. And so far, MFA, and we are managing the system, though we all know that it's quite challenging.
And from your checks across the country, do we know exactly how many children in your facilities have been infected?
For now, we do not have the exact figures, except, of course, some of the few ones we hear from the news, like from your source giving us here and there. This is because it's a technical issue. They don't just bring out figures anyhow. They have to be sure of what is happening before they churn out the figures. So now we cannot be sure of what figure we have, except what has come out, confirmed by school authorities and other bodies attached to it. Then we all take it up and work with it. As CHAS, we do not expect that when there is such an issue, members will call the executive to tell them that I have these at my school level. Rather, what we do is that from the school level, we contact our NECs, which are our district, metropolitan, and then municipal directors of education, inform them. Then from there, it moves to our regional level. Then from the regional level, it may move to the national level. This is our procedure of communicating to the public. So therefore, it is after all this has been done, then we as members at our meetings through our platform, we also get to know that, oh, this has happened in school A or school B. Thank you.
Well, at this point, I'll just get straight into the questions. I don't know if Professor Gyapong is back with us because he was telling us about the tests that they've conducted. They've been conducting the tests for the schools in Akosombo so far, and we would want to hear the situation at UHAS. Professor Gyapong, let's try you again. You were telling us about the tests that you've conducted so far, and then also you tell us about the situation at UHAS. You've recorded cases as well at the tertiary level. I'm sure you've been interacting with your members.
Now, I'm speaking on phone now, so
we'll manage. We'll manage.
Okay. So, about 10 or so days ago, we had reports that a child had been exposed, and this is as a result of information from the parents of the child. So, the school decided to do a testing of the child. So when we tested, the child was positive, and therefore we had to do the contact tracing as laid down epidemiologically. And the initial numbers were very high, which was quite alarming. So we alerted the school, and they put in place all the necessary protocols to ensure that the right thing was done. So I was surprised that 6 or so days after the event, there was a lot of hullabaloo in the media about some schools in Akosombo having tested positive. As far as I'm aware, their parents were informed and they were told that they were in good hands. The children were all asymptomatic, and therefore there was no real cause for alarm. And so far, so good. I think we should rather be commending the school for doing the right thing and ensuring that everybody was tested. I mean, it was quite a bit of strain on our resources, but we have to test 500 students from the school. Having said that, within the universities, and when I talk about the universities, VCG has the membership of 15 universities. The 10 traditional ones, which all of you know, University of Ghana, KNUST, UCC, EUW, Winneba, UDS, UMAT, UHAS, UNER, Sunyani, UPSA, and GIMPA. These were the 10 original, and now we have 5 more being added from Stomanya, Nabrongo, WA, the Ghana Communication Technology University in Accra, and then I think in Apiaminka, also in Kumasi. So there are 15 institutions that form VCG.
And out of the 15? I've
contacted most of our people, most of the vice chancellors have confirmed that there have been cases reported on the various campuses, but they've all been managed as per the protocols, apart from 2 or 3 universities who said they had not recorded any incidents. All of them have recorded incidents, and we are managing them according to the protocol.
Do we know the numbers? Because it appears that out of the 15, 13 or so have recorded cases in all the tertiary institutions that you oversee. How many cases exactly do we know?
I don't get into the details of how many are in which university. I mean, I could speak to UHAS, but I don't think that is the most essential thing. At least here in UHAS, at least 8 or 9 students have tested positive.
Okay.
And about 10 or so faculty and staff have also tested positive. And they've all been managed. Many have recovered without any incidents at all.
It's just important that we know the numbers at least. Then we know what actually we are dealing with. Then we can see how we can curb the spread. But let's get into the questions, because there are loads and loads of them, so that we can cover as many questions as possible. So we get into the first batch of questions at this point. We'll start from WhatsApp. And this one says, how widespread is the virus at the tertiary level, and how are you containing the spread? Gladys is asking. We have another one from Abla, says the tertiary students were already using the virtual platforms to teach and learn. Shouldn't it have remained that way? Sweetie is asking, as a vice chancellor and a scientist as well, do you think it was prudent to reopen school at a time we are experiencing the second wave of the virus? Most of it going to Professor GYAPONG. And Kwesi says, how are lecturers, teachers and non-teaching staff being protected? Professor George Kufuor of KNUST died only last week. His diagnosis came on the back of reopening of schools. Okay, so that's the first batch of questions, a number of them. So it appears that most of them goes to you, Professor GYAPONG, as a scientist and a university vice chancellor also. They're asking a number of questions to you, whether we shouldn't have stayed with the virtual platforms that we already had. Professor GYAPONG.
Hello.
So there were questions for you. How are lecturers, teachers and non-teaching staff being protected? He's speaking on the back of Professor George Kufuor of KNUST, who died only last week. His diagnosis, he says, came on the back of reopening of schools. He's also asking whether we shouldn't have stuck to our virtual platforms, and then also how widespread is the virus at the tertiary level. You've been speaking about it. So you can quickly touch on all the questions that have come to you, then we can go to the others as well.
Yeah, thank you very much, Mr. once again. I mean, it's very unfortunate that some faculty have passed, and we sympathize with the family of the faculty who have passed. I think it's very, very unfortunate, and this, in my opinion, is a reflection of what is going on in their community. So, as we speak now, from the data that is available, at least 20% of our population is probably infected. And the second wave that we are having, as you know, has had the strains from the UK and South Africa, which are more virulent and spread much quicker. So it is expected that, unfortunately, the numbers will be high, and it's very unfortunate, as I said, that we've had some incidents of death. Having said that, many of our universities have started rolling out their learning management systems to ensure that there is teaching online. However, there is still the need to do some face-to-face engagement, especially for the practical session. So I believe many of the vice chancellors are having academic board meetings to review their systems to see how best to address the situation. In my conversation with many of my colleagues this afternoon, many are deciding to reduce the number of face-to-face engagement and to do a lot more of the online engagement so that we can minimize the level of contact between students and faculty.
So this questioner is also asking, as a vice chancellor and a scientist as well, do you think it was prudent to reopen schools at a time we're experiencing the second wave of the virus? If we can touch on that briefly.
Oh, I personally think that life must go on, and we need to learn to live with the virus. Staying at home, I'm not sure would have given us any different results. So the important thing is that we are on our campuses. We make sure that we keep to the right protocols and the safety protocols and ensure that everybody keeps to the protocol. Yes, it is known that even when you wear the nose mask and all that, there is still a limited risk that one could still get infected. But if we are able to keep to the protocols to the best of our ability, then we are able to minimize the level of risk. So I think that it is still good to have universities and tertiary and basic schools to open. At least from the data that I have seen so far, I think it was the right thing to do.
Okay. Dr. Ampedu, let's talk about the level of compliance. Your inspectors are on the ground. Someone is asking what punitive measures are there for schools that do not have the basic facilities to comply with the protocols. Generally, let's talk about compliance from what your inspectors have gathered.
Encouraging to know that most schools are complying with the protocols. When we were on the ground, in terms of wearing of face masks, sanitization facilities like Veronica buckets, running water, etc. Most schools, and I'm not talking about just private schools, public and private, had these systems in place. What rather we observed was a bit of overcrowding, where students are not necessarily social distancing. But in terms of the regular sanitization protocols, schools are doing quite well with it, and it's encouraging to see. As the president said in most of his address recently, we are going to have to live with the virus, and I think Professor GYAPONG has stressed on that point as well. So we have to have measures by which we can live and continue with our lives as much as possible. And those measures are us abiding by the protocols that have been put in place for us to be able to stay safe. And when we go to the schools to do what we call compliance inspections, we look at, okay, how many students can access Veronica bucket, how many classrooms are there, how many need to run a shift system versus don't put all the students in one class. Maybe because you cannot do the 2-meter rule, you may have to run a shift. When we were in Akosombo, for instance, we found out that the school was crowded to some extent. So one of the recommendations from my inspectors was for them to run a shift system. And starting on Monday, the school is running a shift system. So these are the things we are doing to help schools abide by the protocols in these times. I would like to place, I would like to also say that to parents that we are actually doing our best to ensure that learners stay safe in schools, and that we should all be encouraged that school owners, the proprietors, are willing to do the right thing and provide the right resources for them to be able to abide by the protocols. And I've had parents call me worried about their wards in school because they've heard that a child tested positive in the school, or the school is not observing the protocols as appropriate. When we hear these things, we follow up and we make sure the school does the right thing. But in general, the schools are being quite compliant.
But 79 cases in one school, it gives cause for concern as to the number of cases in other schools. Do we have the figures in terms generally? What do we know? What pertains in other schools? We've talked about Akosombo, that school in Akosombo, 79 cases. I've already seen a number of messages on what pertains in other schools. Do we know? Do we have the figures?
So we are the National Schools Inspectorate Authority, regulators of school in terms of compliance, monitoring and evaluation. We don't necessarily track the numbers of COVID cases. That is the mandate for Ghana Health Service to do. So when we go to the school and we hear that there's a positive case, ours is to ensure that the protocols that have been laid down are being taken seriously by the school proprietors. So we don't so much as go counting the numbers, but we do inquire as part of our data collection processes how many people have tested positive in the school. So we've done, so far, we've gone to about 4 regions so far where we've heard of cases in the school, and we've gone to ensure that they are abiding by the protocols, or if they are not, then they put in measures to ensure that they are abiding by the protocol. So I don't have the number. And I think the numbers as reported by Ghana Health Service, as you mentioned at the beginning of the show, is what we all go by, unless we get a call, particularly for a particular school, like we did for Akosombo, and then we go on the ground to ascertain for ourselves what is really going on.
Have you had cause to punish any school so far for non-compliance?
Not really. We've had cause to reprimand some schools and to say that you need to do this or we'll come back. And if we come back, it's not going to be the same conversations that we are going to have. I think in this time, what we are also trying to do is to offer the best support that we can offer the schools, because it's a novel virus, which means it's new. It's a new experience for everybody. We are all trying to get used to the managing the disease. So we are not so much as going out to punish people as much as we are going out to ensure that they are doing the right thing. And if they are not, get them the necessary resources. There are schools that we go and they are not in touch with their municipal health directorate. We'll quickly call the health directorate and put them in touch and ensure that they come in and walk them through the protocol so they are abiding by it. So those are the things we are doing to also help manage the disease as much as possible as regulators.
Okay, Madam PHILIPPA LARSEN and Alhaji Yakubu, I'll bring you in on this. First, with you, Madam PHILIPPA LARSEN, are your members, teachers especially, are they concerned about cases being recorded in schools? Have you had cause for concern because they will have to mark books? We've talked about overcrowding in some of the schools. What exactly are they telling? What are the vibes you're getting from your members?
Yeah, MFA, definitely there is so much concern about the cases that are being recorded in some schools. But in any case, like the earlier speakers have indicated, we will have to manage the school system and make sure that we are in school, because at the end of the day, COVID has come to live with us and life must go on. So we have to make sure, or teachers are making sure that the students, the learners, teachers themselves observe all the protocols at the school level so that we all stay safe and protected.
So who is monitoring social distancing in dormitories? How are you monitoring that?
MFA, we have teachers, we have house masters and house mistresses who monitor all those things. And I believe before reopening of schools, the beds were rearranged to make sure that the social distancing protocol is properly observed. And so all these things have gone on, and I don't think that in the dormitories, when the beds have been rearranged to observe that particular protocol, the children will bring them together, because the teachers, the house masters, the house mistresses monitor every now and then. And I must say that teachers are doing a lot of good job in the various schools.
Okay, Alhaji Yakubu, you want to touch on that? Are students required to wear masks even in the dormitories, for instance?
Yeah, Emifa, indeed, the wearing of masks has come to stay with us, though we all know the challenges involved with it. We encourage our students at any given time within their life in the school to be in their mask, especially when they are in their classrooms, within the compound, and even at their dormitory level. We encourage them to be in it. So when you look at that and consider boarding students, meaning invariably you are asking the student to be in the mask almost all throughout his day, except maybe when he's going to bed. And you can agree with me that it's quite a challenging situation. But as school authority, we are doing our best, first of all, educating them to understand that COVID is indeed a real thing. Because when you come to the school and meet the young ones, their behavior is like they are in a different planet from where we are. So we are trying to let them understand that COVID indeed is a reality, and there was the need for them to go by the protocols as stated out, so that we can protect ourselves and curb the spread of it. Students being what they are, it is quite challenging to get them to comply 100% as you wish, but quite a good number of them are complying. And the others, we are hoping with time they will also join and comply, so that together we'll all go by the protocols and be able to curb the spread. When we are on break and the day students are going home, you will see that immediately they leave the gates of the school, a lot of them will pull it below their chins or even remove and put it in their bags. So the following day, education has to go on for them to understand that this observation was made and it wasn't right. So try to do what is required of you. It is when you are even outside in the public that you need to wear it the more, because you meet different people that you are not aware of, you don't know their status and stuff like that. So education will continue as far as this COVID is concerned, so that with that effort we are able to, as it were, control the spread.
Okay, let's get into the next batch of questions quickly, and then we can get more responses to them. We'll stay on WhatsApp. This one says, I'd like to know on today's show what the teacher union is doing about the long hours in school. If they say we are not in normal times, why the long hours? We get tired of wearing the mask. In fact, it's suffocating, and we take them off so we can breathe, which is not the best. I'm sure this is a teacher speaking. And secondly, the KG closes at 12, and we have to wait for their siblings in the upper primary. They are left unsupervised. It's really dangerous. They are without nose masks for 3 hours each day, playing dangerous games, he says. And then the next one is still on WhatsApp. This one is from Seth Anaji in Takrade. He says, I have a little reservation concerning those in junior classes doing only 4 hours. Oftentimes, siblings attend the same school. Do the kids hang around till senior siblings close? Almost the same as the previous message. And this one says, I'm Mohammed Babamu from Tamale. I want to know, when can we write our BC? We're waiting for our BC, he says. McDonald says, shouldn't we stop people from using classrooms as churches in order to stop the spread of COVID-19? McDonald, interesting. And then Boama says, what informed reopening of schools when a torrential wave due to a new and more transmissible strain was ravaging our shores? Could we not have waited further and, if possible, intensify online TV and radio educational programs to allow this wave to subside, or bringing the vaccine to reduce the spread before thrusting the kids into the wild? Pretty much for all of us to respond to. But I'll start with you, Dr. Ampedu. So there are concerns about using classrooms as churches in order to stop the spread of COVID-19. Shouldn't we be stopping people? Is it an issue that has come up at all amongst you know, the visits that you've conducted, and have you had cause to raise this particular issue?
Thank you, MFA. So our visits are usually during the week. So we are not there on weekends to see that church activities are being...
Some of them do it weekdays. Some of them do it weekdays in the evenings.
Well, so we haven't received any such reports, but we are aware some schools use their premises as churches when their school is not in session. And in these times, our advice would be that it's not advisable for schools to be doing that. You are trying to avoid as much as possible coming in, the number of people coming into contact with the school system. So that will not be advisable. But then again, we also have to know that some of these schools that are run by private proprietors, they are at liberty to use their facilities for what they see fit. We'll just plead with them that in these times where learners are going into the same classroom, that hopefully maybe over the weekend they can use it for churches, but during the week, if there's a church that starts, let's say 5 p.m. when learners have left at 4 p.m., maybe not. If there's an all-night service that goes on in a classroom till morning, and then they leave and the students come and they have to use the classrooms for lessons, that will not be advisable. So we'll look into it and see what advice we can give on that. But currently, it hasn't come to our decks yet. Okay,
Madam PHILIPPA LARSEN, I'm sure this is an issue that you quickly touch on. And then also, they're talking about the times that your members, your teachers would have to wear nose masks because they have to wear it for long hours. They say some of them 8 to 9 hours, and it's suffocating. And then also, students, KG students who are supposed to close at 12 but have siblings in upper primary. How are we hoping to supervise these ones?
Yeah, MFA, let me touch on the churches that worship in the school premises. before the opening for the candidates to write their exit examinations and the second years. In the address of the president, he stated that the schools, because they have been fumigated and disinfected, no other activity should go on in the school. And so for me, I do not expect any church to be worshiping in a school premises. That is one thing I know. Now, the issue of the long hours, where the junior siblings are in the primary school.
Unfortunately, there's a hitch there once again to Madam Philippa Larsen's connection. Okay, well, it appears she's back now. Madam Philippa Larsen,
high school and all that. That should be a special arrangement between the parents and the schools.
Okay.
Hello, MFR. So
yes, we can hear
you. Hello.
Yes, we can hear you. Please go on. You're talking about that should be an arrangement.
Once the primary school closes, nothing can be done. The teachers have also closed and they will have to leave the school premise. And so if there is any arrangement, it will have to be done between the parents and the teachers of the school and see how best the children can still be in school, or the children will have to be picked and make sure they are safe and well protected. Now, the long hours that we stay in school, the Director General of Education made mention of the fact that the primary schools will have to close at 12. And so I do not know which long hours we are talking about where we have to stay in school. We have been given the closing time and we have to comply. Any other thing short of that, maybe unless there's a discussion between the community, between the teachers and the GES, for that matter, the Directors of Education, the Director General, and if there is another decision that is taken, then the school will manage it and see how best things will go.
But are we sure that your members are complying in terms of closing at 12? Because it doesn't look like that is happening. Dr. Alhaji Yakub, is that happening in your schools? Are we closing at 12?
No, thank you very much. At the senior high level, we are running our normal periods.
Okay.
And to also add, it is within the guidelines for reopening of schools that school premises should not be used for any other activity apart from teaching and learning. So at a meeting that we had before the school reopened, we were told by GES management not to allow church activities and all other activities to be used or done in our schools. So we have informed all concerned, and we have found that said people have not come to rest. Maybe it is a problem that is still at the primary and then JHS level. And I think with education, all of them will come to know it and will comply.
Okay. Well, on Alhaji Yakub's note, let's bring in some questions. I see a number of questions for the senior high school. We'll get into it, then Alhaji can respond, and where Madam Philippa Larsen can also come in, we do so. So let's get into those questions now. Foster says, is still on WhatsApp, is there any extra allowance for teachers who taught during the COVID period? This is final year Form 2 teachers, he says. Foster is asking. Francisca says, I have two questions. Is there an objective threshold for infections at which schools will be closed down? And two, social distancing in dormitories, assuming day students mix with them in class, can they be separated as in day students in one class for now? Francisca is asking. And then Agbeko says, the manner this government treated the school's PTA support systems, criminalizing payment of finances, contributions, has affected the running of proper management. Agbeko says. Ernest Forbach in Ghana says the government must immediately roll out an aggressive public education across the entire country while enforcing all the COVID protocols. Ernest. We'll take the final one for this batch. We have it. Asuma Kobiri says, are there plans to start exploring the use of bronchoscopy for critically ill patients on ventilators without improvement, as it's proven to save lives in South Africa? How long does the virus stay on the surface of the mask until it dies? When is Ghana rolling out COVID-19 vaccination? I'm sure we have Professor GYAPONG coming back to us. He will deal with the science, but I know Dr. Hager can also deal with these matters of science. But Alhaji Yakub, there were questions for you. Maybe we'll sort that one out, and then we can deal with matters of science, for instance. We'll take Alhaji Yakub's question. Alhaji Yakub, there were a number of them for you. Maybe we'll take them quickly, and then we'll look at the science of it as well.
Good. Yeah, so the fellow who has asked concerning some special incentive for teachers, what I will say for now is that all teachers at the senior high level are aware that there is something called intervention money that is given us within each academic year to, as it were, cushion us for all the extra effort that we are putting in to ensure that effective teaching and learning goes on in our schools. And when this money comes, teachers are aware, we try to share it out to them judiciously. That is based on how effectively you have contributed towards the system. You are recognized and something is given you. So to some extent, that has been addressed. But teachers being what we are, if more is added, we'll be grateful for that. And then moving forward with regards to the social distancing, it is true that we have ensured that in the classroom level, it is working effectively and the teacher is on them throughout the teaching and learning. Coming to the dormitory, we have separated their beds in a very nice manner such that if they indeed stayed by that, social distancing would have been observed. But students being what they are, when they are in the dormitory, in their rooms, they see themselves like a family together. And so, to some extent, they don't understand why am I in a room with my colleague and you still tell me to separate myself from him or her. But we let them understand that, for example, during the classes hours, these students also come. They mix with you up. After classes, they go home. So when you go to your dormitory now, you have not lived with only your dormitory members, but others have come to join. So there was the need, therefore, to ensure that social distancing is still observed over there too.
But the suggestion, but quickly,
they are getting to know and cooperating.
Quickly, Alhaji, the suggestion was that why aren't we separating the day students from the boarders? Maybe a separate class for the day students and a separate class for boarders. Is this something that we're hoping to consider? Is it feasible?
On the availability of resources. Because if we don't have enough resources to do that, then it will be quite a difficult practice to embark on. Because on the average, when you check, the day students that are found in each class form about 10% or even less of the number of the class. And to try and get classrooms for such people separately, it will be quite a difficult task to embark upon. But moving forward, as we said, the coronavirus is a novelty. We are all trying to study it and see what actions we can put in place to address it. So moving forward, if it is seen that it's a necessity, I'm sure the authorities will study it and address it appropriately.
Okay. Madam PHILIPPA LARSEN, I'm sure is interested in the bit about those who taught during that period and whether they are going to, when they are going to receive those allowances. You have anything to add to that? Do we have any information for these teachers?
Like you said, it what is happening. And so whatever amount that comes to the school is shared amongst those teachers. And so we expect everybody to put up his or her best so that he or she will be recognized and given the appropriate, maybe at appropriate time when the amount is given, everybody will have his or her share. But at the basic level, we do not have any allowances, MFA, and that is where the problem is. Because during the COVID, during the lockdown and all that, the second years, junior high school were in school. The finalists, those who were going to write the BEC were also in school. But at the basic level, teachers are not giving any allowance for anything. And so that is an issue that we want to take it up. The discussion has started, and so we'll continue with the discussion and see how it goes. At the senior high school level, they are okay, but at the basic level, we do.
Okay. We lost you briefly. We lost Madam PHILIPPA LARSEN briefly there, but let's take.
I was saying, MFI, please, that point is very important.
Okay.
You see, at the senior high school level, like Alhaji rightly said, they have some sort of allowances that are given to the teachers. And so whether during COVID or not, they are teachers, they have their intervention allowance and whatnot. At the basic school level, during the time that the finalists had to come in to write their exit examination, the second years were also.
Technology will not allow Madam PHILIPPA LARSEN to make that very important point to her. But I'm sure our Professor Gyapong also back with us on the line because there were some scientific questions that came up. It keeps recurring. Dr. Ampedu, I'm sure if you want to chip in also, you can do so. There were questions about what threshold we will get to before the schools will be closed down. Must we get there? What exactly is it? Do we know? Because we're told that on the issue about vaccination, vaccination. So the president had mentioned that in March we're going to get the first batch, for instance, but that's not, that's another question that we'll tackle. I'm sure Professor Gyapong will also help us tackle that. But Dr. Ampedu, I'm itching to hear you on that. The threshold we'll get to before our schools will be closed down. Must we get there? How do we prevent getting there?
Thank you, Amifa. So the safety of our learners is key, and that's what we focus on. Now, in terms of threshold, like Alaji said, the coronavirus is a novelty. It's new. We are now learning a lot about it. So we don't have an exact number that says in a school population of 400, if 10 test positive, close down the school or something like that. We don't have those numbers yet. Currently, we work very closely with Ghana Health Service on advisory to do with the management of the disease. So what is advised is that if the positive cases in the school, that you create an isolation center and isolate the learners in the school. Why is that advisory? Because if you let the learners go back to the community, they are going to spread the disease in the community. So currently, that is the directive, is to have the learners isolate in place at the school. But in terms of the exact numbers or the threshold where you reach and say, okay, this is it, let's close down the school, we haven't come up with an exact number yet. But that is not to say that if we, where I say we, ourselves, Ghana Health Service, etc., determine that a particular school needs to be closed down for further fumigation, sanitization processes, etc., because they are violating the protocols and they were not abiding, and it had put learners in harm's way, we will not hesitate to shut down such a school so that we can do what we need to do to ensure that learners are being safe in that school. So that's where we stand with that now.
From boarding students, it is something that we should be taking a look at, since they will be coming from home and the possibility that they may bring in the virus to the school. There was a message to that effect. Is this something that you're worth considering?
Yes, so that's something that we've been discussing a lot of. And to a largest point, the schools that we were telling to do similar were telling us the same thing Alaji is saying, that of a class of 50, there will be only 5-day students. So if you have to find a classroom for 5 students, you have to change the school timetable and schedule to accommodate 5 students that teachers have to do extra work to teach.
Okay.
So the logistics are not in favor. So what we advised was that in that case, the learners coming from home, if maybe in a classroom, they can be in a certain section. But we know learners, we know these children, that it's not feasible to just tell them stay in one place and do not mingle with your colleagues, and it's going to be what they do throughout the day. So
okay.
what we do is ensure that they go by the protocols, like we keep saying, because in several schools that have the facility, by the way, let me put this on record, schools that have the additional facilities have embarked on that. Schools that do not, that are finding other ways to accommodate the situation. Schools that have facility are doing boarding and then day students in different classes.
Okay. Professor Gyapong, if you're back with us, there's this question that keeps recurring also, the issue about marking exercise books of students and the possibility of teachers being infected because they are concerned that there can be a transfer of the virus. Settle that for us on the scientific note. We also have some science questions also that came in that we would want you to tackle as well after this one.
Hello, can you hear me?
Yes, we can hear you, Prof.
Yes, thank you so much. I wanted to clarify a few issues earlier. I think our focus in managing the schools as they have been opened is to ensure that we have early detection mechanisms so that we can make any potential outbreak in the bud. So the important thing for me is that the teachers and even the students should know what the key signs and symptoms are, so that once they begin to have any of such signs and symptoms, then they can alert their teachers or whoever is in charge, so that they can be tested as quickly as possible. And then they can be, if they are found to be positive, they can be taken out of that population into isolation so that they do not infect everybody else. So early detection and testing is very, very critical if we decide that we're going to keep the schools going. So testing, I mean, the PCR testing that we've been doing is very expensive, and I guess that is one of the main challenges. But in recent times, rapid tests have been approved by the FDA for us to be able to use antigen tests, which are cheaper. I mean, they are not very cheap, but it's cheaper than the PCR. So that if we could deploy all those things, then we are able to do the testing as quickly as possible and get them out of the population. Here at our university, we have sent out an alert that anybody who has any of those signs should make themselves available for testing. They can walk into any of the health facilities or even our testing center and get tested so that we can put them in isolation and treat them accordingly. Another issue is that for those who test positive, we need to manage them properly because there could be psychological issues in there. Some students could be the subject of mental challenges, and also some of their colleagues could be teasing them, and even accuse them of having brought the disease to the school and all that. So we need to have a way of managing those students and counseling them properly, so that even they who have become positive can become advocates and help in educating their colleagues in the various institutions. I think that is very, very, very important.
Okay, but quickly, Prof, and really out of time. So there's a particular question that I was hoping that you could give us answers to, because a lot of teachers are asking this particular question, whether they could be infected by marking exercise books of their students.
I do not have that evidence, and I'll say that the evidence available is not in support of that. The virus we're dealing with is a respiratory virus. So it must be airborne for you to inhale it. So I will say that in as much as anything is possible, the risk is very, very minimal.
Well, that's all time will allow us tonight. But Dr. Hager, Pedu, I'll give you the final word on this since you've been inspecting the schools. Going forward, though, what are we hoping to see in terms of, because parents need some assurances. Okay, so it looks like I've lost Dr. Hager and Pedu, but maybe Dr. Madam PHILIPPA LARSEN and then Alhaji Yakub, you could quickly give us some assurances, because we've been told that, of course, you're managing the situation, but really, parents listening, they want more in terms of assurances that you're able to manage the situation, especially when you don't want to cause fear and panic in the society.
So what we are doing as inspectors, as I said earlier, MFI, is to ensure that there's compliance to the COVID-19 protocols. I want to assure parents that we are on top of that. And to what Professor Japon said, ours is to ensure that the cases are managed well. So there's testing, there's tracking, there's contact tracing, etc. All the protocols we've been advised to follow. Now, if there be a positive case in the school, parents should be rest assured that we'll ensure the school take the right measures to ensure the safety of learners. And there should be no panic in the system, because the Ghana Health Service have put measures in place to ensure that we are all safe.
Thank you very much. Dr. Hager Hilda Pedu, she's Executive Director, Inspector General of Schools, National Schools Inspectorate Authority. We also had Chairman, Vice Chancellor's Ghana VCG, Vice Chancellor UHAS, Professor John Japong, President, Ghana National Association of Teachers, NAT, Madam PHILIPPA LARSEN, and of course, Alhaji Yakub, Head of Assisted Schools, CHAS, also joining us tonight on The Probe. That's all time will allow us for tonight's edition. A Walk with Jesus is up next on radio. Do stay. Thank you so much for your time. I am MFA Pau. On behalf of the entire team, we say thank you.